The next speaker is Julia Rosdell. She's from Duke, and she will be talking to us about macular imaging with different devices. Julia.
Thank you. My financial disclosures are not relevant to this talk, and I would like to thank Dr. Chen and Dr. Ezrani for inviting me to speak with you about macular OCT on different devices for glaucoma. A quick case just to demonstrate how macular OCT helps me to manage glaucoma. This is a gentleman that I saw about 5 years ago. He then was followed about 3 hours away. He decided not to have treatment at the time that I saw him, but he came back to me for a second opinion when the doctor who was taking care of him recommended treatment. When he came back to me, his visual field had a paracentral visual field defect that was not a lot worse over this time. He had an RNFL OCT 5 years ago with the inferior thinning corresponding to that visual field defect, and there looked like there had been some progression, but he was not convinced. We got a macular OCT that showed inferior thinning, and the progression analysis showed these two characteristic arcuate-shaped areas of progressive loss, and he was finally convinced and did start treatment. So we'll cover briefly why the macula is where the money is for glaucoma, and we'll look at 5 devices and their glaucoma protocols and see some examples both of glaucoma and non-glaucoma. So glaucoma blindness happens when retinal ganglion cells die, and the macular thickness is predominantly made up of retinal ganglion cells, and most of the retinal ganglion cells in the retina live in the macula. Macular thickness is also really doesn't have a lot of variation, unlike the optic nerve head, so it makes it really quite useful for glaucoma. As you'll recall, retinal ganglion cells are in 3 layers in the retina. Their axons are in the nerve fiber layer, their cell bodies are in the ganglion cell layer, and their dendrites are in the inner plexiform layer. Those 3 layers together are termed the ganglion cell complex, and thinning in these layers happens from glaucoma. There is considerable variation in the number of retinal ganglion cells sampled during automated visual field testing due to much higher numbers of retinal ganglion cells centrally compared to peripherally. There are 5 commercially available devices with the glaucoma protocol for image acquisition and analysis. They're the Cirrus from Zeiss, the Spectralis from Heidelberg, the 3D OCT from Topcon, Avanti from OptiView, and the RS3000 from Nidec. The Cirrus and Spectralis are more highly represented in the literature, and the Spectralis is the device I use clinically, so we're a little heavier on those examples during this talk. All of the devices show high levels of structure-function correlation for glaucoma patients, and in particular, they appear most useful for patients who have mean deviations better than -10 decibels on automated visual field testing. The main differences between the devices are in the areas sampled and the layers. The Cirrus uses data from an elliptical annulus centered on the fovea that's 4 millimeters high and 4.8 millimeters wide. The Spectralis uses data from a 10 by 10 millimeter square, the Topcon, a 7 by 7 millimeter square, the OptiView, a 7 millimeter diameter circle centered 1 millimeter temporal to the fovea, and the Nidec, a 9 by 9 millimeter square. The macular analysis from the Zeiss includes a thickness map of the ganglion cell and inner plexiform layers. There's also a deviation map and table comparing that thickness to an age-matched control, and the report also includes horizontal macular OCT scans of each eye. The macular analysis for the Spectralis includes a thickness map for total retinal thickness, as well as 2 asymmetry plots for the asymmetry comparing the 2 eyes to each other, as well as comparing the superior and inferior hemimaculae within one eye. Heidelberg also has a system called the Glaucoma Module Premium Edition, which allows for segmentation of individual layers of the retina. And this is an example of a patient with glaucoma. And there's the total retinal thickness, the retinal nerve fiber layer thickness, the ganglion cell layer thickness, and the inner plexiform layer thickness. The TopCon device produces a report with a thickness map of the ganglion cell layer and a deviation map of that layer. The OptiView device produces a report showing the ganglion cell complex thickness as a percentage of the age-matched control. And this ganglion cell complex, again, includes the nerve fiber layer, the ganglion cell layer, and the inner plexiform layer. And the right eye and left eye are shown with summary tables. Like the OptiView, the NIDEC device displays the thickness of that nerve fiber layer, retinal ganglion cell layer, and inner plexiform layer. And the report includes a thickness map as well as a deviation map. This is an example of a patient with glaucoma using the Cirrus device. So this patient has an inferior macular thinning area respecting the horizontal meridian, and it's also seen on the thickness map and deviation map. This patient has more advanced disease, worse in the inferior maculae of both eyes. You can see loss of the yellow on the thickness map and more of the red on the deviation map. This is an example from Spectralis of a patient with early glaucoma. There's a characteristic arcuate-shaped defect superiorly that's seen on the asymmetry analysis as well. In this example of a patient with a paracentral visual field defect, you can see the macular thinning approaching the fovea. Here's an example of a patient with more advanced glaucoma, and the maculae are diffusely thin, but there is some thickness in that parafoveal area that can be measured and followed, particularly helpful in this patient who can no longer perform automated visual field testing. Here is a patient with primary open-angle glaucoma imaged with the OptiView device. The glaucoma is worse in the right eye, and there's inferior thinning in the ganglion cell layers, that's the RNFL, the cell layer, and the inner plexiform layer, displayed as a percentage of the age-matched control. Finish with just a couple examples that might not be glaucoma that you might see when you're using the glaucoma protocol of the macula. So this patient has diffuse thinning of the ganglion cell layer, but the RNFL is intact, prompting consideration of non-glaucomatous etiologies. This patient has age-related macular degeneration, so the macular maps are irregular and less helpful for following glaucoma. This patient has had multiple retinal vein occlusions with resultant thinning of all layers of the retina, not just the layers of the ganglion cells. And this patient suffered an episode of non-arteritic anterior ischemic optic neuropathy, and there's subsequent macular thinning in that eye. So we've looked at a number of examples of macular OCT on the different devices, since it's really useful for examining the cells that are affected by glaucoma. The commercially available devices differ in the areas that they sample, as well as the layers that they assess, but all of the devices perform similarly with respect to structure and function correlation. I'd like to thank the colleagues who shared cases and images with me for this presentation, and thank you all for your attention.